Welcome back. I'm the Dr. Bob Lee from 107.5 WBLS and Bronx Nets, Channel 67. Thank you for tuning in, and thank you for checking it out. Our next guests are the Director of Take Care NYC and Test and Trace Corps, and the Assistant Vice President of Ambulatory Care for NYC Health and Hospitals, and the Executive Director and Chief Executive Officer of NYC Health and Hospitals and Community Care, and the Chief Equity Officer for NYC Test and Trace Corps, as they join us today to speak about COVID testing and tracing protocol and their hotel isolation program. So please welcome to the show, Dr. Amanda K. Johnson, Nicole Jordan Martin, and Annabelle Palmer. Welcome. Can you tell us about your roles with the NYC Health and Hospitals and the NYC Test and Trace Corps?
Absolutely. I'm happy to go first, Bob. So as mentioned before, I'm Dr. Amanda Johnson. In my pre-COVID role, I serve in the Office of Ambulatory Care. I'm an assistant vice president, and I focus on care models for individuals who are vulnerable by virtue of having a history of incarceration, experiencing homelessness, and other factors. I'm also a primary care doctor who works at one of our federally qualified health center sites in Harlem. And then in COVID times, I'm serving as the director of Take Care. Take Care is the portion of the Test and Trace program that helps individuals safely and effectively isolate or quarantine after they've contracted or been exposed to COVID-19. And I'm really excited to be able to tell you all a little bit more about all of the aspects of this particular program.
Okay. And who wants to go next?
I'll go next.
Annabelle?
Sure, go ahead, Annabelle.
Hi, I'm, as Dr. Lee mentioned, I'm Annabelle Palmer. I'm the Chief Equity Officer on the Test and Trace Corps. Prior to taking on this role, I was serving as Deputy Commissioner of the Department of Social Services in New York City. I was charged with working under the leadership of Commissioner Banks, around homeless issues, as well as human resource issues around the city.
Mm-hmm. And Nicole?
Hi, again, good morning. So I'm Nicole Jordan Martin, and I have a dual role right now. I currently lead the Community Care Division of the New York City Health and Hospitals Health System, which provides care management and home care services and programs to our patients so that we continue to care for them once they leave the walls of our hospitals and health centers. And in my role related to New York City Test and Trace Corps, I'm leading the day-to-day operations for the isolation hotels.
I like it. Tell me more about the isolation hotels, because you hear a little bit about it, but you don't hear a whole lot.
Sure. So the hotel program was born in early April, right after we started to experience the first surge of COVID in New York City. We at New York City Health and Hospitals felt like we needed to provide this critical resource to curb community spread and prevent and control community spread recurring from individuals who were being discharged from our hospitals and our emergency departments. So the program was initially born to support our hospitals in being able to have a place to safely discharge individuals who required isolation. Since then, it expanded and became the New York City Test and Trace Corps Take Care Hotel program. And we believe that it's a fundamentally critical resource to offer New Yorkers, both residents and visitors, to really curb and mitigate this community spread of COVID-19. It is a very comprehensive program and includes transportation to and from, continuity of any care needs that our guests have when they come to the program, whether it's social service related or their medical or mental health needs. All of those needs we can address with their existing healthcare providers or connect them to new providers as well. There are a lot of social needs that we can address at the hotels, including needs for access to food, access to medications, housing for individuals who are unstably housed or homeless, et cetera. So it's very comprehensive, and we have clinical staff, nurses, physicians, social workers, and other support staff to assist individuals when they're at the hotel as well.
Okay, and that's set up through Health and Hospital. So it's a visit to the hospital, and then the hospital sends them to the hotel. Is that the way it works?
Sure, that's one of the ways. There are other ways. Individuals can call 311. They can call the COVID hotline, which is 212-COVID-19. They can also be connected to the hotels through the contact tracing program, which I'm sure Dr. Johnson can describe further.
Dr. Johnson?
Happily. I do want to underscore the other modes that Nicole mentioned earlier, though, 311, calling 212 COVID-19, because it is so essential that people isolate at the first sign of symptoms. So it's great, and I'm going to tell you all about how to get tested. I'm going to tell you all about what contact tracing entails, but one of the mantras, the refrains that we're trying to really get out in the community is don't wait, separate. When you have symptoms, when you learn that you've been exposed, that's the time to get out of your house, or else you run a really high risk in those first early days of transmitting COVID-19 to your loved ones, to your roommates, to your family members. And things that we're really worried about right now include the rising positivity rates in older adults and people who are over 75. So for your grandparents and great aunts and uncles, really be mindful of your symptoms, be mindful of your health, be mindful of the risks you're taking, and use one of those other options to isolate early in your course of exposure. But as Ms. Jordan-Martin mentioned, contact tracing is another way that people learn about our hotel program, and then the other options that we have to support people who are isolating or quarantining at home. Annabelle might be getting into a little bit more of the footprint of our testing sites, but let's say that anywhere in the city you present and are tested for COVID-19, that test result comes to our core of contact tracers who will reach out to you by phone to get some information from you. They want to understand where you work, if you work, they want to understand whom you live with, and they want to know the people that you may have been in touch with over the past couple of weeks during the times that you were likely to have been infectious, so that they can reach out to them, encourage them to get tested, and we can break those chains of transmission early on. At the end of that interview.
What's one of the things that people can latch onto upon receiving a phone call like that? Because a lot of people who hear a phone call like that and they think, wow,
oh yeah,
they're standoffish. But what's one of the codes? What do you guys say in the beginning so that people can understand that it's from you guys?
Yeah, so we'll identify ourselves as being part of New York City's Test and Trace core. And if you go onto our Test and Trace website, that's testandtrace.nyc, there's actually a place where you can verify your contact tracer. I know that, in New York, people are savvy. And so you want to make sure that you really know who you're talking to when you're giving out information. You can verify who your contact tracer is by going online if there's any concerns, but you have a right to know who your contact tracer is. And I'm pleased to report that your contact tracers are other members of your community. We went to great efforts to ensure that the people who are talking to you on the phone, are your neighbors, are your community members, have some understanding of what you're going through. And the other thing that I want to mention is that the information that we're asking of people is to help us better understand the spread of COVID-19, better understand how to support you, but we don't ask anything that we don't need to know because we want to protect your information. And the best way to protect it is not to ask for things that we don't absolutely need to know. I know that for the communities that we're serving, public charge is a real concern, and utilizing the hotel program, getting vaccinated, getting tested, doing all these things does not constitute a public charge. We have bigger things to worry about. The virus does not care where you come from. And so we're here to support everybody. But an excellent question, Dr. Lee.
Included in this, there is a vaccination program, right? You guys have to get vaccinated first, frontline workers.
So frontline workers are one of the priority populations for vaccination right now. And I'm sure that you have heard about the ever expanding vaccination efforts in the city. We are so excited, and we're actively advocating for the priority populations to be brought online as soon as possible, because that is a really important tool that we have to stop the spread of the disease.
Yeah, and before that, and even after you get inoculated, you have to stay in line with the 3 W's. Wear that mask, watch your distance, and wash your hands. I say that on the radio, and we say it on TV too, the WWW. Wear that mask, watch your distance, and wash your hands. You guys are going to start using it?
Oh, wow. I don't know how I can forget it at this point.
I-
The only thing I'll
I
add
think
to that is like monitor your symptoms and separate safely, but we'll think of a way to work it in. But you
There
are
you
correct.
go.
You know, it's not going the core four, as we like to call them. But you're correct. After someone gets vaccinated, it does not mean that you can stop wearing your mask right now. There are things that we need to do. One, it's going to take some time for people to be vaccinated. And so you have no way of knowing when you walk down the street or when you go into a grocery store who has been vaccinated and who isn't. So right now we're all wearing masks until we all get the vaccination. I think the other thing to keep in mind is we know that it prevents you from getting sick, but we need to have more time to understand its impact on mitigating the spread in the community. So right now, you know, remember our 3 Ws, our core fours, and then as vaccination comes online, that's another tool, but we're sticking with the game plan. We're not making any changes. We're not peeling back yet. That's not where we are in this pandemic.
That's right. Annabelle.
Yes, so I'll pick up with Dr. Johnson had mentioned in terms of testing sites. We have hundreds of testing sites throughout the city of New York, and to find one is as easy as calling 311 or calling our COVID hotline 212 COVID-19. We can't stress enough, you know, that information because we want individuals to really have it in mind. We just went live with 22 mobile units this week, including 15 of those mobile units with rapid antigen testing, and that's in partnership with our nonprofits. We're expecting at least another 25 mobile units, all of them using rapid antigen tests, and that'll give us a total of 40 rapid antigen units throughout the city. Each rapid mobile unit can perform at least 300 tests a day, and in addition, 25 teams are assisting with self-swabbing throughout the city Monday through Thursday. So our testing commitment to our community, especially communities that have been hardest hit by COVID, it's live, and we want to make sure that New Yorkers continue to access testing and to take care.
Yeah, that's great. Where can we go to get more information on what you guys are doing?
nyc.gov/COVID test, and all the information will be at their fingertips.
Thank you. Thank you, Dr. Amanda K. Johnson, Nicole Jordan Martin, and Annabelle Palmer. We appreciate you, and thank you so much once again. We'll take a break right here. Bobby C. is up next. He has the latest in the world of sports.